This program is brought to you by Emory University.
In this study, we looked at added sugar in adults in the United States, and we looked at cardiovascular disease risk in association with the added sugars. What we found was that the more added sugar that somebody consumed, the more likely they were to have a low good cholesterol and high triglycerides. So in other words, the more added sugar, the worse their cardiovascular disease risk. Added sugars are caloric sweeteners, so sweeteners with calories that are added to food to make them taste better, to make them more desirable. It's things like high fructose corn syrup, like cane sugar, honey sometimes, any kind of a sweetener put into foods and drinks. This study is important because added sugars has really increased in the food supply. And we found that people eat an average of about 21 teaspoons per day of added sugars. And that level of sugar was associated with increased cardiovascular disease risk. So we think that by decreasing added sugar consumption, people can improve their health. In our study, we looked at a range of consumption of added sugar ranging from 5% per day to greater than 25% of calories per day. And what we found was really the best cardiovascular disease risk factors, so the best cholesterol levels, were in people eating 5 or 6 teaspoons per day of sugar or less. This was a cross-sectional study, which means that we looked at people at one moment in time. What we really need to do next is to do a study where people who already consume a lot of sugar reduce the amount of sugar. And from that, we'll know for sure that reducing sugar can improve the heart disease risk.
The preceding program is copyrighted by Emory University.